is Jeff McGee. I work at UAB Medicine. I'm a Senior Director of Imaging Services, mainly focused in the ambulatory environment. A few years back, we started meeting with our local reps to discuss the RAD room opportunities within our system. We were actually expanding services at the time over to Whitaker, which is adjacent to Kirkland Clinic, which houses our primary care services, family medicine. So we had an opportunity to put a RAD room expansion there. Met with the vendor a few times to see the product, was impressed with the product. So we decided to move forward with that. And so I thought it'd be a good environment to test the system to see how it fit in, how our technologists liked it. And so it worked well. And so when we moved forward and had another opportunity, we put Shimadzu at the forefront when we looked at new equipment.
It's fantastic. Between another manufacturer that we have next to the Shimadzu, the image quality is more detailed, the resolution is better, and it gives us, for lack of a better word, prettier images.
Yeah, Shimadzu service is excellent. It rarely goes down. I can't remember the last time it went down. The only time when it's down when they do quality checks. But when it does go down, when we call it off service, it's usually here the next day. It's usually fixed that day.
This newest piece of equipment, we had the DDR technology available. Dr. Singh, our head pulmonary radiologist, really had an interest in the technology. So at that point, we knew that's the system we wanted to go with. So right now, we're mainly focused on post-COVID patients, transplant patients, both pre and post-transplant. And then there's some other applications that's at the radiologist's discretion, but we've kind of been mainly focused on that subset of patients right now. Well, first, the radiologist is able to see more of a real-time image. So opportunity there that they're not having to refer for a CT. Our biggest thing has been like with sniff test. We've kind of transitioned sniff test from fluoro over to the DDR. That's probably been our biggest benefit. So, we're not tying up a fluoro room just to do that. We can just do the chest x-ray, the DDR along with it. Radiologist has that information available. So early on, we got to looking at the CPT codes for that. There was two opportunities for us. We could either bill as a chest x-ray and then do the cine radiography bill add-on, or we could bill as a standalone cine radiography. Yes, very satisfied. Again, thankfully, we haven't had a lot of downtime, so it's mainly been PM maintenances. So they're very good in communicating about setting aside time to do that, to try to not disrupt our workflow. So they kind of work around our schedule. So very responsive. I know with the new system, being new technology, we've had to do a lot of tweaking with that, and they've been very responsive. If it's coming in, we're having to do any upgrades or working on a process that would be related to service, they've been very responsive.
Excellence in science. Shimadzu.